3-point people to ensure no one could get lost in the system. The Triad concept is based at Walter Reed's Warrior Clinic. Sergeant Ashley Bryant has more.
The clinic was actually a concept. This is the only one within the Department of the Army where we have a consolidated, dedicated warrior clinic that has the Triad, which is in here.
The Triad is a fairly new concept for Walter Reed. It's meant to surround the transitioning service member with appropriate guidance and care. Each outpatient is assigned a primary care physician, a squad leader, and a nurse case manager.
Hey, I called this twice. When are you guys going to call me in?
Oh, you want your driving test,
I want my driving test.
Oh, well, I can work on that.
Staff Sergeant Dale Cherney has been at the center of his triangle for 10 months.
Well, when we first seen him in the hospital, he was in really bad shape.
I lost a leg below the knee. I have pins and rods in this leg. The spleen's gone, and then I lost my eye.
It was more than 2 months before Sergeant Cherney knew he was surrounded.
My care has been great.
The primary care doc's job is to prescribe care. The nurse care manager and the squad leader are there to make sure those orders are carried out.
So you're kind of the muscle.
Yes, pretty much.
Squad leader Staff Sergeant Nick Williams manages the maze of paperwork that can sometimes slow progress. He also sometimes manages motivation.
Hey, you're still a soldier. And just because you're injured, things are not going to stop rolling.
The Warrior Clinic may be the home of the Care Triad, but at least for this group, the care has been anything but clinical.
I actually cried in front of her once or twice, so...
Along with helping Sergeant Cherney heal his physical wounds.
Hey man, in the military, you cry every once in a while.
Get over emotional wounds.
He's found out outside of himself that he didn't know that he actually has, he's very emotional.
Sergeant Cherney was working as an accountant at Camp Liberty, not really expecting to see combat when the base was attacked.
Corporal Pearson died next to me. Why am I still here? So it's a weird, I can't answer that question right now, so this is one of the times that I actually cried. So I buried that side long ago, but that's a deadly demon to bury emotions.
That's a big thing he and Captain Monroe talk about.
But I don't think that's bad that you feel like the rocket may change your life.
It's a bit morbid, but as I look at it now, it actually was a good thing.
But it's also the little things that his caretakers know about him that make the difference.
There's a rose garden behind Abrams Hall, and he says that's where he kind of finds his peace.
And Wisconsin. So he got a big old house, and he grows corn in the back. So that's nice.
The bond you develop, as with any leadership in the Army, I mean, you trust your team leader, you trust your squad leader, you trust your commander.
A solid structure of care,
Sergeant Major too, awesome.
Bonds with caregivers seems to be taking hold. Marine Sergeant Ashley Bryant, Pentagon Channel News.
Immunization, or the lack of immunization.
Yeah, that's pretty good report. It's pretty good layout of the whole plan. Sorry, after watching Generation Kill, there's...
But many parents are reluctant.
Oh man. Anyways,
they're concerned about autism.
yeah, it's a very good report.
Master Sergeant George Bauer has more.
So, oh, and so smart move on sending the cute girl to the hospital.
There's really no scientific study that shows that there's an increased incidence of autism in people who get the vaccine.
The vaccine is the measles, mumps, rubella vaccine, which many parents are rejecting for their children, fearing that it may cause autism. The result, according to the Centers for Disease Control and Prevention, a sharp increase in the case of measles in the United States. Last year, there were only 42. And for the first 7 months of this year, there are already 131 cases of measles. 15 of those patients had to be hospitalized. Measles is usually recognized through a red skin rash. It's a highly infectious and potentially deadly virus that spreads through contact with an infected person. Dr. Meg Fisher, a national expert in immunizations, says the misconception may arise because the signs of autism generally become noticeable between 15 months and 3 years, around the time children receive their vaccinations.
It happens to be at around the same time that they got the vaccine, so the vaccine gets blamed. But in many of those children, if you actually go back and look at the family photographs or the family movies, you can see, and many parents will realize, that yes, that child was different long before they were given the measles vaccine.
Doctors concede it's still not clear what causes autism, but increasingly the evidence points to genetics.
As we find out the actual causes of autism, people will feel better. In the meantime, though, there's absolutely no evidence that the measles, mumps, rubella vaccine causes autism. And that's based on studies that have been done in this country and in other countries where they compare the rates before and after the vaccine, and they also compare the rates if people got vaccinated and didn't get vaccinated.
Of the 131 cases, 112 of them were unvaccinated, something that's troubling for health officials.
Because we're really afraid that if our immunization rates start to drop, we're going to see even more measles, and we're going to see a recurrence of these diseases that we really had under check.
The CDC says measles is no longer endemic to the U.S., but every year cases enter the country through foreign visitors and Americans who travel abroad. Air Force Master Sergeant George Maurer, Pentagon Channel News.
Now let's go to the Pentagon Channel newsroom where Sergeant Ted McDonald has...
Very good report, and not sensational, too. I recommend the blood type diet. Check it out, and a lot of interesting stuff that talks about in there. So, not too sure what to tell families in the military, but it almost seems like, well, wait a minute, if the military will cover things like fertility, eye surgery, breast enhancements for women, could they conceivably also look into genotype mapping, DNA mapping for infants? So I mean, in a weird way, possibly you're looking at a Gattaca scenario unfolding, because if you consider that well, anyways, because if you're saying it's genetic autism, well then how do you change? How do you alter the genetics then, or how are you going to roll the genetic dice and try to get a more favorable outcome of an offspring? So, but I don't know. But it does take care of obesity, a blood type diet.